Augusta University continues to take charge when it comes to fighting COVID-19. Kim Vickers has more on what they're accomplishing and some answers to your questions.
Researchers continue to make strides in COVID-19 research. Believe it or not, the CSRA is only 7 months into the pandemic, and medical experts say that research takes time.
The focus is on the Regeneron compound, and if this drug, which uses the antibodies of recovered patients, can keep those infected from having complications and ending up in the hospital.
We're just about to start the same study with the same drug for outpatient patients that are not admitted to the hospital, that have mild disease, to see if we can prevent some admissions, seeing if we can send these patients home and not have them come back.
Dr. Vasquez says they have been studying the compound on some of the sickest patients, but this study is the only one of its kind.
So we're actually pretty excited about that one. Giving it in the outpatients, it's the only study that's being done at the outpatient setting.
I asked Dr. Vasquez about a study done in Europe that says people with certain blood types are less susceptible to the virus. He says people with those blood types shouldn't get too excited.
According to the one study, Danish study, it appears that those individuals that have O-type apparently have lower rates of infection. But it is a really loose interpretation.
Melinda Woodell from Shepherd Blood Center agrees.
And so we're seeing the same thing that we're seeing with the A's and the O's. About 5% of those donors are testing positive. So I can't correlate to say that they're immune or not. I think it's just the luck of the draw of their blood types, really.
AU is also studying the risk of reinfection in those who previously tested positive for COVID. I wanted to know if people who were asymptomatic or had mild symptoms had a higher risk of getting it again.
But we do know that if you don't have these high, what are called neutralizing antibodies, right, that take care of the virus, you're definitely at risk, probably at risk for reinfection.
Dr. Vasquez says he wants people to understand that not everybody who tests positive for COVID-19 will have antibodies, but that currently reinfection is extremely rare. Reporting in Augusta, Kim Vickers, WJBF, News Channel 6.